Hi, everyone. I'm Ava Barone, and I'm the Vice President of Community Outreach for SmileChild.
And I'm Ilona Opesterd, and I am the Director of Events for SmileChild.
We're so excited that you guys are both with us today. To give a little bit of background about SmileChild, SmileChild is a Columbus nonprofit that empowers caregivers by providing comprehensive education and resource connections to ensure that every baby has a chance to smile. We are fighting infant mortality using multiple approaches, including an incentive-driven, module-based smartphone application, as well as community events. In order to make key information more accessible, SmileChild is partnering with moms-to-be and researchers at Nationwide Children's Hospital to implement an educational app focusing on topics such as smoking cessation and safe sleep practices for infants. We also host community events to increase general knowledge and awareness of infant mortality in Central Ohio. These strategies, we're hoping to bridge the gaps in education, health, and preventable infant death. Today, we're hosting a podcast, and we're really excited to be here with Liz Klein and Lara McKenzie. Would you both mind introducing yourself really quickly, please?
Sure, I'm Liz Klein. I'm an associate professor in the Division of Health Behavior, Health Promotion in the College of Public Health at Ohio State University.
And hi, I'm Lara McKenzie. I'm an associate professor at the Center for Injury Research and Policy at the Abigail Wexner Research Institute at Nationwide Children's Hospital.
Awesome. Thank you both so much for being here. We're so excited to have this conversation about your research. And when we initially saw your paper on the College of Public Health website, we just were so excited and kept talking about it because of its relevance to our own roles in SmileChild. We just started getting the hang of kind of running a social media that's public health based. And when we saw that research, we were just kind of amazed at how applicable it was and wanted to make sure we integrated those techniques into our own social media progress. So Ilona, if you want to go ahead and get started, we have some questions we'd like to go through today and just kind of have a conversation about the significance of your research and just talk about your study.
So to start off, could both of you talk a little bit about like your education, the research you've been involved in, and what led you to the field of public health?
I'll go ahead and get started. So I like to call myself a public health lifer. My undergraduate is in community health education, and I didn't find public health directly. It was the fourth major that I found as an undergrad because I was really interested in primary prevention. And those were the very early days of public health undergraduate programs. And I finally found my way into community health and was so excited to have a program that really focused on populations, but also with a focus on prevention and health behaviors. But I went on to do work and practice and also got interested in evaluation and epidemiology. So my MPH is in epidemiology and biostatistics from the University of California, Berkeley, and my PhD is in behavioral epidemiology. So I found at the end of my academic training, this sort of two slices of the Venn diagram between epidemiology and health behavior, which is really where I fit, focused on behavioral epidemiology. Most of my research is really centered around tobacco control and primary prevention, but Lara and I had talked over the years, given our shared interests in health behavior, health promotion, and this project was a real opportunity for us to do an integration with the work that I do in eye tracking, which I'm sure we'll talk about in a little bit.
So similar to Liz, public health wasn't my first academic stop. I have a psychology undergraduate degree from George Washington University and a master's in psychology from the Catholic University. And one of my very first jobs that sort of led me then to public health and on to getting my PhD in public health was a project that I worked on at the Children's Hospital in Washington, D.C. I was one of the research assistants on a project that was collecting data from the emergency department on about how children were injured in their homes, what they were doing, were there any safety products being used, and my job was to abstract that information from the charts, but then also follow up with a telephone interview to learn more about what happened. And I really became interested in injury prevention from working on that study. And you know, injury prevention really falls under a public health umbrella and not so much the psychology umbrella, but the two things come together because psychology and behavior change, that's really at the root of the stuff that we focus on in injury prevention. How do we adopt healthy behaviors, or how do we adopt injury prevention behaviors, and encourage in the best way possible for parents and caregivers to take action to do these things. So it was kind of the marriage of psychology and public health for me. And then I went on to get my PhD at Johns Hopkins Bloomberg School of Public Health, and with a focus on social and behavioral sciences. But I've always focused, my sort of topic and content interest has been around injury prevention.
Yeah, that's really exciting to hear about both of your backgrounds, especially given the ties to what our nonprofit does. We also really want to encourage parents to take action and focus on preventable injuries. And then on the other side, with even tobacco, we want to focus on secondhand smoke and the impact of that across Columbus, especially. So kind of moving on to the study a little bit, we'd love to hear from both of you on what your unique contributions were to the study, and just kind of give both of your perspectives on some of those and your initial thoughts.
Liz, would this be a good time for me to sort of set up why we got interested in this topic?
Yeah, that'd be great.
And Ava said I could share my screen to show you all a picture that might help illustrate what we're talking about here. And for those of you that might be listening, just listening and not able to see any images here, what I have on my screen is a slide that shows an example of a Twitter social media post and one from Facebook. And what's shown in this image is a post from the NICHD, which is one of the institutes at the National Institutes of Health. And the post reads, NICHD supports AAP Global Health, urging parents to stop using crib bumpers. Thanks for covering this study, and that it tags a reporter and the CNN network. And then there's an image, a photograph of a baby in a crib with bumpers. And then at the bottom of the image, there's a tag that says, stop using crib bumpers, doctors say. And then on the other side of this page, we have a post from Cribs for Kids, National Infant Safe Sleep Initiative, with the heading Safe Sleep Around the World. And then it says, under an image of a baby sleeping on what looks to be maybe a sheepskin rug or blanket with a crocheted hat that's tied around the baby's neck. The image is tagged to say, new research from Sweden, infants should sleep in their own bed to reduce risk of SID. So for your listeners who probably are already a little sort of tuned into what safe sleep looks like, or maybe what not to do. So the recommendations are to not use crib bumpers to prevent suffocation, to not have babies sleep on soft surfaces, not have things tied around their necks like hats or clothing, to prevent strangulation. And so both of these are examples of very well-known and reputable and credible organizations that promote safety behaviors, promote injury prevention. And yet the images that they used to talk about and post about their topic are really counter to what the recommendation is saying. And so these are literally two examples that came up on my own feed. I, of course, as an injury prevention professional, follow these organizations, and not every parent does, but I do. And I was kind of surprised to see that the text that they're promoting and the recommendation and the photo that they chose to illustrate this are just a complete mismatch. And so this was an example of something that we called unmatched. They're just, the text and the image do not match. And this, example of something we saw in our own feeds sparked a question about, how do parents understand information that we're posting when an image and the recommendation or the text and the image are not a match? Is that harder for people? Does it draw their attention? Does it make them interested to learn more? And it really kind of dovetailed on some prior work that we'd been doing to understand what do parents know or learn or understand when they read or see news stories about injury prevention recommendations, and where do they go for information? And then also, how does health literacy or e-health literacy affect what they understand when they see this kind of information? So that was a long way of showing you sort of how we got interested in the topic, but I'm going to turn over to Liz now to talk a little bit more about how we used eye tracking as part of the study.
Yeah, thanks, Lara. So for your listeners and watchers, eye tracking is essentially a technique that you can use. It's an equipment that attaches to a monitor, just like the one you're probably looking at, or it can attach to a phone. But essentially, it's a near infrared camera that shines a light on an individual's eye and creates a reflection off of that eye that's captured by the camera that can incredibly precisely track what someone's looking at when they're looking on screen. So what it allows us to do is to very precisely record and capture information about what people are paying attention to when they're looking at content, whether it's an advertisement that is a sort of traditional sort of print ad that's static, or something more dynamic like a GIF, or a short video, or a commercial, or an entire movie. So you can basically capture what an individual or a group of individuals is paying attention to when they're exposed to content. So given this interest in answering the question about whether or not people pay more attention to the image or the safety recommendation that's in the text, and how that relates to their understanding of the safety message, was a natural match with the eye tracking research that I do. So Lara and I had talked about combining this eye tracking techniques into a study designed to allow us to examine what happens when people see matched images, irrelevant images, or unmatched images between safety recommendations and pictures. So we wanted to really understand this. And while we could have just asked people, well, what did you remember and what did you see? The benefit of an eye tracker is that you can precisely capture how much attention, down to the very few milliseconds of how much people are paying attention, how much they look at a picture and then look to the text and look back. So it gives you a lot of information that's both objective and well beyond what most people can remember when they look at a social media post.
Yeah, that's really interesting to hear about, especially for Ilona and I, just given our roles running the social media for SmileChild. Sometimes we almost don't even realize just how powerful those images are, because we're kind of trying to strike that balance between, getting as much attention to the issues we can with maybe more eye-popping graphics, or just more visually appealing posts, but then also knowing that our mission of obviously getting the most correct and scientific information out there to people, and just making as many people aware as possible, is kind of a tricky balance to figure out. And that's why we're both so interested in this technology and how the significance of the study.
Well, and Ava, you're not alone in that struggle, because even much larger government organizations are in the same boat. They're struggling with, do we create posts that are attention grabbing to maybe build our base, build their followers, for example, or get attention, versus is social media a tool for them, or their Twitter feed, for example, is it a tool for people to learn information about a particular topic and what to do, or is it just like I said, to get more followers and then maybe move to behavior change. So I think even my point is, even larger organizations maybe aren't sure what they're doing either. So it's not surprising that you would say you're struggling with it. I think a really good example of this is, I don't know if anybody follows the U.S. Consumer Product Safety Commission on Twitter. They have their approach is to increase their followers and increase attention to consumer product safety and consumer product safety related injuries and maybe how to prevent them. But they do it in a way that's kind of got a bit of a comedy to it, a comic feel to it, by they'll have a floating baby over a field and it'll be, you know, pay attention to baby safety month. And so it's like, why is our baby floating and, you know, over a field, and it gets your attention. But, you know, I think where Liz and I are landing, or where we think this work is going, is to really be the most effective to change a parent's behavior, because for us, that is like where this is going. Is a floating baby above a field the way to illustrate that, or make the best case for why someone should do something? I don't know. And I think, you know, that's at the heart of why we did this work.
I just want to add too that we've talked about a couple different examples of social media serves lots of purposes. So what we're talking about specifically in this paper relates to sort of under comprehension of these safety recommendations. So do people understand the message we're conveying? And so, but communications are complex. And so not every single social media post's intention is to teach someone something about, you know, safety or about any kind of topic. They have different reasons for trying to attract in a perspective, you know, followers' attention. So it's important to also keep in mind, what is the goal? What are we trying to do? So I mean, social media can be fun and irreverent and can have all kinds of, you know, silly, fun content to it. But in this particular context, we were very much focused on, do people, if you have a mismatch between, you know, the recommendation and you show people sort of the wrong behavior, do they understand the right action, or are they kind of confused? And so, because that is an important aspect of what we're talking about in terms of safety recommendations, and of course, a lot of other health behavior recommendations too.
Yeah. So another piece of our study that I think helps contribute to this picture is not just the eye tracking, although that is a huge part of this study, but we did an online survey that was nationally representative of parents who use social media, and we wanted to find out what they're looking for, what they're searching for when they're on social media. And yes, it can be entertaining and on all those things, the time wasters that we all love, but 81% of the parents that we surveyed told us that they were looking for health related information, or looking for parenting related information, or looking for child safety or injury prevention information when they're on social media, when they're on the internet and things like that. So they are looking for this information there. And I think that is a clue to organizations that do this kind of work, that that's a place where we should be putting our messages. You know, for organizations that do this kind of work, I think it's an indication that they're hungry for that information and we should be posting it there.
Yeah, definitely. It's really interesting hearing both of your perspectives on that, especially just as we kind of consider within SmileChild that our target audience is kind of in two different directions. We're posting a lot for college students because that just happens to be the main group of people we know right now. But then also remembering, like you've discussed, that we want parents to also be able to use our content in an educational way as they have any children or are pregnant, and we want to make an impact in that group of people as well. And that, I think, ties in a lot to what you've both discussed about the study.
I also think it's important that since people view social media as like it's not going to be incorrect at times, people just like go in with the idea that anything I see on the internet is true. We just have to be so careful because like as a nonprofit, like people trust us just because of that brand. So we want to make sure that we're not doing anything that's going to confuse people or get the wrong message across.
Mm-hmm. Yeah, that's true. I mean, credibility of the organization that's doing the posting is really important. I think, or building that credibility with good information is probably really important as well.
Could you discuss a little bit like the implications of the research in terms of educational content on social media? I know you touched on that a little bit.
Sure, I can say a little bit about that. So our primary outcome here was that we found that when we presented this group of parents, 150 parents, when they looked at these posts that had some matched, some mismatched, and we captured their eye tracking data. And then after the end of the exposure to all these different posts, we asked them about what, sort of a little quiz of what the correct safety recommendations were across all of the aspects that we'd asked them. And what we found was that the matched posts attracted more attention and that attention was associated with improved recognition of the right answer. So basically they paid more attention when the posts match, they better understood how to answer the question about what is the safety recommendation being made. So I think that the takeaway in this specific context was that, the recommendation would be matching the post. So not including saying don't put your baby in a crib with bumpers and then showing an adorable baby in a crib with bumpers is not the right strategy. That we need to both give a clear recommendation to the target audience and then show and demonstrate the correct action in particular. So we have a lot of questions about what's next and thinking about the other types of recommendations that could be made to parents and how to optimize these, social media messages, just like you were talking about in the beginning of like, how do we leverage and make best use of our social media? I mean, there's so many things that we hope to continue to explore with this vein of research, because there's really not, there's some best practices out there, but it's kind of a wild west, as it were, because there's all kinds of content being put out there, even by credible agencies. And so we really need to have better theory-based, evidence-based guidance on how to really convey the best information to followers, whether it's safety recommendations or anything else.
I think one of the difficulties too is particularly for injury prevention topics is that there's not a lot of readily available or free images that can be used that actually illustrate the right behavior. If you wanted to make a post about safe sleep and you started Googling, images for cute babies or sleeping babies, you're going to find so many that are really showing the incorrect behavior. That's the vast majority of the photos that are available. And so I think someone who may be running a social media feed for an organization, or they may have the best of intentions of actually putting a good post together and showing the right info or talking about the right information, but when they come to find the picture to go along with it, they're finding a cute baby and maybe they're not noticing some of the things that are shown that are incorrect. They might not be that familiar with the topic. They may not have other access to free images and maybe not a budget to go do their own photo shoot to shoot the right way. But I always like to compare and contrast this to a topic that I don't work in this area, but I think one that anybody can sort of get behind in their understanding of is when you talk about healthy eating or physical activity. So think about those topics for a second. If you were going to make a post about eating your fruits and vegetables every day, you would find an image of like a healthy looking salad or some fruits and vegetables, and that's what you would show. You wouldn't go searching for an image of somebody laying on a couch eating chips to talk about healthy eating. And so it's sort of like, why are we doing this with injury prevention? Or why are we doing this with safe infant sleep, for example? Why would we want to show the not safe behavior or the not recommended behavior? Because in healthy eating and physical activity, we see people walking and drinking water and getting exercise. We don't see someone who looks sad and unhappy laying on their couch. We see the opposite. We see what we want people to do, the sort of aspirational behavior that we want them to achieve. But for injury prevention, we have a lot of the time, and we still do this, and not just safe sleep, but not a lot of other topics. We show the hazard, we show the danger, we show the risk. And that is not often illustrative of what to do to prevent that behavior. So I feel like we're doing our field a disservice when we do that. That's my feeling. And I think this is the research, I think, that's helping us defend that point, that we could do a better job to give people as much information in a, obviously in a format that is quick, that you're scrolling through, that your eyes are going to just glance over, maybe read for a few seconds, but what can we get the most bang for our buck in that time to sort of have them take away the right information.
I'll just add to that too, that so my primary area is in tobacco control, and in that space, we are aware of when you show an image of a tobacco product that for users that are either trying to quit or currently using, when they see that cigarette in someone's hand, it's a cue to smoke because it's an addictive behavior. It's a little different than what Lara's talking about, but if you think about the last time you read an article about vaping or quitting or anything related to that, they show you the product, which is essentially a cue to not quit. And so even though there's an awareness of that, it's also a difficult something to depict. I mean, you can go out and find stock photos of someone breaking a cigarette in half or, you know, stomping on a cigarette, what have you. But there's also some logistic challenges in the tobacco control space of like, what do you depict as the correct behavior that is the absence of something? So it gets a little bit nuanced quickly. I think the examples that Lara gave make an enormous amount of sense, but I think this just illustrates how much we have to think about the messaging and what's our goal? Are we trying to inform people? Are we trying to help them understand making, what the correct actions might be, or modeling that, that successful behavior, but also understand the fact that, we're providing cues, like it or not, to some kind of action, and we want it to be for the proper action, because we know that at least in this particular study that it relates to better outcomes in terms of people understanding what we're trying to make in terms of safety recommendations.
Definitely. I think that those are all great points. One thing that resonated with me that you mentioned, Dr. McKenzie, especially, was about how people running these social media accounts often we would think are not ill-intentioned. They don't want to give the wrong messaging. Mm-hmm. And I think that was something Ilona and I discussed a lot when we were running these accounts, is how we didn't really have a marketing background, but we did have more of a science background. I'm in pharmaceutical sciences, Ilona's in public health. But you could see how that could kind of go the opposite way when you're running an account, is you do have the marketing background, but maybe not as familiar with the science. So yeah, sorry, do you want to add something, Dr. Klein?
No, I think it can go either way. I mean, so you can have folks that have the science background, but not the marketing background. And so it's sort of, you need all of the things. And so I think I will just add, and I think that as agencies get, understand the fact that social media is a legitimate tool of communication. I think in the beginning, there was a lot of sort of agencies were a little slow to get on board with, do we need to do this thing? Is it important? And so, because I think initially, again, this is my opinion, but I think a lot of times agencies were like, oh, this is not that important. We don't have to put a lot of resources into it. It's just something we need to do. Let's do it and not worry too much about it. And I think what we're realizing with the research that we've done is it's actually being viewed by people. It's being attended to as content that is treated as, valuably as other kinds of communications. And it's important and nuanced, and we can't just, fling something out there, just go put something out there. That's all we need to do, box checks. I think it's important to take time to make sure that the folks that are managing social media need to at least check in with folks if they're not sure, hey, is this the right image? Does this make sense? It needs to be more than just like, oh, I don't know, just pick a stock image and throw it up there with a post. We just need to have posts at this interval per day with this many posts. It's more complicated than that, and it influences the followership in a way that is more meaningful than people might not have initially realized.
I think another piece that kind of ties onto what Liz was talking about is, we're talking about, or the couple of examples that we've talked about are, one of us or someone at an organization having control over a particular feed and being the one that's actively making the posts and creating the posts. Then there are, when people or news agencies maybe cover the research that we put out and then pick their own image to put to accompany a story too. So like we might be able to control at our own institution what images are tied with our work or associated with our work, or we think is a good illustrative example of a topic or the behavior that we want people to achieve or the call to action that we want them to take. And then our story or our research gets covered by another news agency, and someone there is like, oh, this is about, babies that sleep. And so they pick an image that again might not match or show the right behavior. So having control over it, what the goals are, who's in charge of it. These are widely varying topics depending on what you're talking about, who's in charge, what the goals are. So it's not that straightforward. We're making it seem like it could be or it should be, but I really think it's a much more nuanced kind of approach to the whole social media. But Liz's point of that parents they go to social media for information on these topics, that's the clue to me, or that's the proof to me that says we need to do a better job of what we're putting in the social media. We know they're going there for information. They're not going to read a long article. They're not going to read a peer-reviewed journal article about the topic. Nope. I mean, hardly anybody wants to read those, if you're honest, right? Just the peers that do them. We are the ones who read those, but the general public doesn't read that. That's not where they're going to get the information. They want to know, bike helmet. I got to look up bike helmets for my kid. They're going to go to social media, go to the internet, Google something, do it quickly, and Pinterest even, finding some information about a topic. And you're going to see things there that aren't the right behavior. And so we, as the professionals and the content builders and the researchers, we need to put the right information there where they're looking for it.
Yeah, that's really interesting. Also, how you tied in the news stories, just because just this week, I actually, in my pharmaceutical research class, we had a whole discussion just about the reinterpretation of these peer-reviewed articles into these news stories, and then how these attention-grabbing titles or attention-grabbing images often conflict or really just don't tell the whole story. I think that definitely ties into social media, exactly like you were saying, when you're just trying to get that attention, or you just really aren't even aware that the image you're putting out is maybe sending a conflicting message.
So let me just add on to that, because you mentioning pharmaceuticals reminds me. So one of the reasons so my primary area being in tobacco and communications, a lot of the work that I do relates to warning labels on tobacco products or messaging about tobacco products, including e-cigarettes. And in doing some of this work, one of the things that I learned about is how much science goes into those pharmaceutical ads that include imagery, while the voiceover talks about all of the negative side effects, which is of course a mandated disclosure. And there's an enormous amount of science that's put into what are the optimal images that will distract the listener from, or the viewer from, hearing about you might have, a side effect of pain and, discomfort or diarrhea or what have you. What is the best imagery that we can put forward so that people are not listening or paying attention? So it's both visual attention and auditory attention. I mean, it's so amazingly nuanced to think about how do we convey information appropriately, because there is actually a lot of evidence that in more sort of traditional marketing advertising that really capitalizes on that attention and manipulates sort of to minimize people's paying attention to those negative aspects and emphasize the benefits of the product. And so so I think it's just a good example again of how this is a complex area. But I think the takeaway is with attention to, no pun intended, with attention to the task at hand of thinking about what's my message on social media, what am I trying to convey, who am I trying to reach, what's the best way to convey this both in writing and visually to my audience. I think those are things that any social media manager should be capable of doing, and if they can get that breakdown, I think what people are likely doing is they're just not simply drilling down and thinking through those steps. So even though we're talking about things are nuanced and it's complex, I think that many of the solutions I think are actually straightforward and feasible. It's not like it requires 20 years of clinical trials to get the answer to some of these things. Not to say that our study answers all of them, but it certainly implies the direction. That is, if we match the image with the recommendation, you're more likely to have people understand your messaging when you're talking about safety recommendations. I think we need to continue to pay attention to this issue, build our evidence in how to optimize, communications for health, because 80% of adults are online seeking health information. And that it crosses the digital divide. I mean, you talk about being able to reach populations that we really want to reach. They are accessing online content through social media, through through the web, all different means. I mean, we really have an opportunity to reach a very diverse audience of folks, and I just don't think we're taking it seriously enough. But it's something we're capable to do as researchers, but as in nonprofits, as agencies and organizations. I think we all have this capacity.
Mm-hmm. I kind of think a checklist for people would be, we've talked about this on our team and on the study is, maybe that's a goal for this work, that it could be a simple checklist tool that, if you're posting about this and your goals are thus, that you want to look for these things to either be present in your photo or not in your photo, or some way of calling out the type of image that you're looking for, and then maybe down the road a body of images that we know meet the criteria, that are good images, if you will, or that show the right behavior or illustrate the right behavior without being misleading or whatever, and could be made available for free. I think that might be the ultimate goal for us in this, if we continue this kind of work, I think.
Definitely. I think that's a great way to kind of think about the future and think about the next steps, is just thinking about, can there be some sort of checklist or just universal idea about how to approach social media, which social media is kind of ambiguous. So I'm not sure what that would look like, but it's a really interesting idea, and we're excited as we continue working with social media to consider your studies and maybe future studies and research about these ideas. It looks like we're kind of coming up on the time, so I just wanted to say thank you both so much for your willingness to participate in this discussion, and we really hope that we can have a lot of people engaging with this podcast and get your research more out there, so that maybe more people who are managing social media accounts can gain a better understanding of this research and hear about it. So thank you both again so much.
Thank you.
Thanks for having us. It was great talking with you both.
Mhm.